Today's video will be taking a look at responsibilities of those working in care for Unit 2 of BTEC Health and Social Care. So, first thing we need to think about is what are the responsibilities of care. Now, working as a professional in the care sector, whether it's health or social care, you are required to follow a code of policies, procedures, all of which are designed to protect the users of care, and it's the Value Care Base, which was created in 1992. Now, the values, or the Care Value Base, basically sets out the right ways, the correct standards that should be used to treat people. The ultimate aim of the standards was to improve the quality of life of those using care, but also to set a standard for care providers. So examples of these care values would be sort of anti-discriminatory practice, empowerment of individuals, ensuring safety, maintaining confidentiality, and good communication. There's also the code of practice that was based around this, and these codes of practice are standards of professionals to follow. They're set out when professionals begin their role, and they're monitored by bodies like the GMC, NMC, and the HCPC. Now, those key organisations we mentioned, the GMC is the General Medical Council. They monitor doctors, consultants, surgeons. The Nursing and Midwifery Council, the NMC, would monitor nurses and midwives of all standards and levels. You might also include the RNC and other bodies focusing on nurses and midwives. The HCPC is all about the Health and Care Professionals Council, and again, these would be all other people involved in care sectors, physiotherapists, paramedics, speech therapists, and again, set the standards for their involvement and interactions with patients. A big element of this is promoting anti-discriminatory practice. And again, to do this is obviously a key factor in providing care, making sure that you are not discriminating against individuals, and you're also reducing likelihood of discrimination to occur. Anti-discriminatory practice aims to make sure that the care needs of service users are met, regardless of whether they come from a particular race or ethnicity, their particular age, disability, sexual orientation. And the key thing is prejudices of staff are ideally challenged or not included in care. This has a connection to the Equality Act of 2010, and this is where a lot of anti-discriminatory practice is linked and based. Essentially, the Equality Act sets the standards, the identification of groups who need to be protected, and they are age, sexual orientation, sex, religion or belief, race, pregnancy and maternity, marriage and civil partnership, gender reassignment, and disability. So these are the protected groups. And examples of ways that you can be more accessible within health and social care to incorporate different groups would be sort of providing easy access to buildings, giving longer appointments to those with disabilities, using different types of signage, leaflets in various languages, providing alternative hospitals and clinics for people who can't get to them, or allowing family or friends to go with an individual if they are uncomfortable in that situation. The key aim of all this is to make sure that professional practice is free from prejudice and discrimination, but also encourages practitioners to challenge discrimination when they see it. And the key things here is that professionals need to address their own potential prejudices. They need to understand different cultures, the diversity of society. They need to challenge any discrimination they encounter or they witness, and also they need to provide compensation for the negative effects of discrimination. So that might be providing additional support to particular groups who are likely to face prejudice or discrimination. So, for example, additional support in terms of employment or gaining employment for people with disabilities because they are likely to experience discrimination. Another key thing to look at is empowerment. And empowerment is making sure that you support people and allow them to take control of their lives, but also take control of their treatment and care. So ways that you can incorporate empowerment and empower an individual is letting them express their needs and preferences, promoting their independence, providing support in line with their beliefs and wishes, letting them have choice of services, putting them at the heart of service provision, and keeping them informed. There are some downsides that come from empowerment. So there are high demands of care that may not be able to be delivered. You might also find that there are medical practices which go against the care value. So for example, allowing someone to refuse a blood transfusion which would be necessary to save their life. When you promote individualized care, you're empowering an individual. You're tailoring the care to their specific need. You're making them feel valued. And again, this can help people overcome issues like if they've lost confidence or they feel, unsupported in society. Empowerment will provide some compensation to those feelings and attitudes. It also is really important for self-esteem. It raises an individual's self-esteem, their self-respect, their confidence, and their self-worth. And by boosting this self-esteem, it will encourage them to make progression with their recovery and their treatment, keeps them involved in the care plan, keeps them informed, they know what is happening, gives the individual an element of control, so they feel that they have some control over their treatment, their care. And again, that's going to add to their self-esteem. They're going to feel valued and important. If their condition is quite severe, they might lose a sense of identity. So by letting them have some control in the care plan, it gives them some control over their illness. And lastly, empowerment means that an individual is more likely to be treated as an individual with their preferences and values respected. And ultimately, it increases independence. So professionals can empower people in lots of different ways. An occupational therapist can help someone have more control over day-to-day activities. Midwives can empower newborn mothers and help them with postpartum depression, help them how to schedule their time, how to care for their baby, how to maintain their independence. Healthcare assistants might allow an individual to have some choice over what to wear, what to eat, how they're cared for. An occupational therapist, again we've mentioned, will work with lots of different people and support patients with routines. Doctors will help explain conditions, help discuss treatment options. We've mentioned midwives, again, different ways of maybe postpartum or antenatal care. Again, helping with pregnancies, and obviously a children's support nurse, for example, might give parents more support, more choice, keep them informed of what's happening with their child. And it may even help children to understand what's happening to them. And there we have it. So a little bit about responsibilities of those in care, particularly anti-discriminatory practice and empowerment. Again, hope this has helped. Thank you for watching. If you could like, subscribe, tell your friends, all those things would be greatly appreciated. And as always, thanks for watching and take care.